Hello and welcome to this infection basics video. I'm Dr. Allard Roberts, and in this video we're going to look at microbial pathogenesis. Specifically, we're going to look at the disease process and how microorganisms damage a human host following infection. Now, when we talk about disease, we're not talking about the presence of microorganisms. That's the infection process. The disease process is what happens to the host, so damage or dysfunction in cells and tissues as a result of that infection. Now, this damage normally manifests itself as symptoms associated with the disease due to a loss of regular physiological processes. Now, this damage can come directly from the pathogen through toxins or cell invasion, or indirectly from our own immune response. So let's look at some of these mechanisms, starting with toxicity. Now, toxicity describes the damage caused when microorganisms produce harmful factors such as toxins and enzymes that directly injure host cells or tissues. This injury then leads to a loss of normal cellular or tissue function, disrupting normal physiology, and in most infections, this damage is what manifests clinically as symptoms. So let's have a look at some of the harmful factors that pathogens produce to damage localized tissues, as well as some that have systemic effects across the entire body. So first up, microorganisms can cause damage by producing a range of extracellular enzymes that break down host structures and protective barriers. Now, our first example is mucinase, an enzyme that degrades mucus, which is the protective layer covering epithelial cells. And so, by removing this barrier, pathogens can reach and interact directly with epithelial cells, and we can see this in organisms such as Vibrio cholerae, Helicobacter pylori, and Neisseria gonorrhoeae. Another important enzyme is keratinase, which breaks down keratin, the tough kind of structural protein found in our skin, hair, and nails. And so this allows microorganisms such as ringworm-causing fungi and in bacteria such as Bacillus subtilis to breach strong physical barriers in our skin. Then we have things like collagenase, which targets collagen, a major component of connective tissue, meaning pathogens can degrade collagen fibers and spread through tissues. And so parasitic worms and Clostridium perfringens use this to infect deeper tissues beyond the initial infection site. And finally, we have hyaluronidase, which breaks down hyaluronic acid, and this is the kind of glue that holds cells together. Now, this is highly effective and it allows the spread of movement between host cells, and so we see various pathogens producing this, such as Staphylococcus aureus, Streptococcus pyogenes, and Clostridium perfringens. And so together, these enzymes show how toxicity as a whole can directly dismantle host defenses and tissue structures, enabling both damage and the spread of the microorganism. Now, some pathogens produce more specialized enzymes that manipulate normal host processes rather than simply breaking down tissues. And coagulase is one such enzyme. It hijacks the host clotting system by converting fibrinogen into fibrin, forming a clot-like barrier around bacterial cells. This effectively shields the bacteria such as coagulase-positive Staphylococcus aureus and Staphylococcus epidermidis from immune attack. We then have enzymes like staphylokinase, which binds to plasminogen and converts it into plasmin. Why is this useful to the pathogen? Well, plasmin degrades fibrin clots that would otherwise wall off an infection, allowing microorganisms to spread rapidly through tissues. And this contributes to invasive infections such as necrotizing fasciitis and is produced by organisms such as Staphylococcus aureus. Now, our final example is streptokinase, which functions in a very similar way to staphylokinase, the key difference being that this is produced by Streptococcus pyogenes. Now, this is a little bit of a tangent, but sometimes we can use harmful microbial products for good, and so streptokinase has been refined and purified into a therapeutic drug known as streptase, which is administered intravenously to treat thrombi and emboli. And for those that don't know, a thrombus is a blood clot that forms on the wall of a blood vessel, while an embolus is a blood clot that has broken free and travelled through the bloodstream. And so by using this to activate plasmin and break down fibrin clots, streptokinase dissolves these clots and helps to prevent dangerous blockages within our blood vessels. Okay, so next we have toxins, which are poisonous substances produced by living organisms that disrupt normal physiological processes within the host. And so the ability of a pathogen to produce these toxins is known as toxogenicity, and it can vary wildly. Some organisms produce only a few toxins or toxins with relatively weak effects, whilst others produce many toxins or highly potent ones that cause severe damage even at low concentrations. And this leads to a fundamental principle in toxicology: the dose makes the poison, first described by Paracelsus in 1538, and so the amount of toxin present is just as important as the toxin itself in determining the severity of disease. Now, toxins come in a lot of different shapes and sizes, and many are often classified by the primary tissue or system they affect. And so neurotoxins target the nervous system, disrupting nerve signaling and affecting muscle movement, sensation, or consciousness. Enterotoxins act on the gastrointestinal tract, interfering with intestinal function and often causing symptoms such as diarrhea and vomiting. Hemotoxins affect blood cells or blood vessels, leading to tissue damage and impaired oxygen delivery or clotting abnormalities. And finally, we have nephrotoxins, which target the kidneys, disrupting filtration and fluid balance and can ultimately impair renal function. Now, each of these toxin types damages the host in a different way, and so if we look at some specific examples in each of the categories. So for our neurotoxins, we have the botulinum toxin produced by Clostridium botulinum, which blocks neurotransmitter release, leading to flaccid paralysis. And we have tetanospasmin produced by Clostridium tetani, which has the opposite effect, interfering with inhibitory nerve signaling, resulting in sustained muscle contraction and spasmic paralysis. For our enterotoxins, we have the cholera toxin produced by Vibrio cholerae and the heat labile toxin of Escherichia coli, both of which disrupt intestinal ion transport, leading to fluid secretion into the gut and diarrhea. Next, we have hemotoxins such as the alpha and beta toxins of Staphylococcus aureus, as well as streptolysin O produced by Streptococcus pyogenes. These all damaged host cell membranes and usually lead to the lysis of blood cells, hence their classification as hemotoxins. And finally, as an example of a nephrotoxin, we have the Shiga toxin produced by Shigella dysenteriae, which damages the kidney cells and can lead to severe renal complications and renal failure. Now, taking a step back, not all damage is caused by toxins. Some pathogens cause disease and damage through their invasive actions. And so, invasive disease involves the penetration of host cells or tissues by pathogenic microorganisms. So rather than remaining on the surface where they initially adhere, the organisms move deeper, entering host cells or spreading through host tissues. Now, it's important to point out only some pathogens do this, and so an example we'll look at is Salmonella, which invades cells of the gastrointestinal tract using its invasive mechanisms, helping it to spread through host tissues and structures, and this is a multi-stage process, as we'll see. And so it all starts when the microbial cell adheres to its target cell using various adhesins such as fimbriae. The bacterium then activates specialized type 3 secretion systems which directly inject bacterial effector proteins into the cytoplasm of the host cell. Now, these effector proteins don't kill the cell immediately. Instead, they manipulate host cell signaling pathways and disrupt actin filaments within the cytoskeleton. This leads to ruffling of the cell membrane, causing it to fold around the bacterial cell as it's pulled into a vacuole within the cytoplasm. Now at this point, the cell is hidden from the immune system and it can undergo cellular replication within the host cell with little to no consequences. Now over time, there will become a point where bacteria are released from the infected cell and can spread to neighbouring cells or enter systemic circulation to infect distant body sites. Meaning this final stage allows the infection to progress beyond the initial site of infection and potentially increase the severity of disease. And so if we were to summarise the disease process, at least from the microbial point of view, once we have infection within a host and the microorganism is growing, there are two pathways that lead to damage of the host, completing the disease process, and these are toxicity and invasiveness. And of course, toxicity refers to damage caused by microbial products such as toxins or enzymes that disrupt normal host cell function. Invasiveness, on the other hand, describes the ability of the microorganism to enter, spread through, and directly damage host tissues, often triggering further immune-mediated harm. And ultimately, it's the damage that explains why patients feel unwell. When tissues are injured or normal physiological processes are disrupted, the body can no longer function as it should. Those disruptions are what we recognise clinically as fever, pain, inflammation, or a loss of function. So symptoms aren't random side effects of infection, they're direct consequences of host damage, and understanding that link helps us to distinguish infection from disease, and explains why treating disease often means limiting damage, not just removing the microorganism. And with that, we come to the end of this video. Hopefully you found the content useful, informative, and most importantly, easy to understand. Thanks for watching, and I hope you have a great day.